Here we go.
Here we go. Dr. Rowe, you and I are live and we are talking about your interview on my summit. It's the Biology of Trauma Summit. It started already on Monday, but your talk is airing today. And you are my favorite psychologist because for a number of reasons, right? There's not just one. There's a number of reasons, but you put natural and effective in the same word, in the same sentence. And that is one of the reasons why you are one of my favorite psychologists. And because your talk was all about activation and the stress response, and why sometimes talk therapy is not the place to start for people because it may actually just increase that activation. So give people a little bit of a background on what does activation mean? Like when you use that word, what does activation mean?
Activation, means that something is making our nervous system, which, our autonomic nervous system regulates our stress response. Something is causing it to get a little stressed out, a little hyperactive, a little jacked up, whatever word you want to say. And, when we think about things from the brain instead of thinking about the emotions behind things, right? And not that emotions aren't important, but we all know that whether we're stressed, we've had a traumatic event, we've gone through a chronic, illness, whatever is going on, there are triggers in our environment. Maybe it's a sound. Maybe it's the birth of a grandchild. I mean, there can be so many reasons that just cause our nervous system to go from, if you've got a trauma history and you haven't dealt with it, you're already hyper stress activated. You're already living beyond what should be a more relaxed state. And then boom, these things just push you over the edge. And then that dysregulation results in any kind of behavior. It can be anxiety, it could be irritability, it could be sadness, withdrawal. And that's really what activation is. And once we're in an activated state, Dr. Aimie, just like you said, we cannot process language, we can't think right, and we can't act right. And talk therapy is essentially a waste of time. And I think anybody who's had, traumas and done a lot of therapy work, they feel that way. It is important, absolutely important work. It needs to come when you've reduced the activation of your nervous system. And that's when it really, you get to what's behind it, folks. And you put it away and you deal with it. But until you regulate that nervous system, you're going to be stuck.
Yes. And so we talk about in this summit how trauma gets stored in the body. And when we talk about like, where exactly does this get stored, right? Like, is there a cabinet that's just for trauma, right? Where exactly is trauma stored in the body? It's stored in the nervous system, and it causes this dysregulation and activation that you're talking about. And until we have the proper tools to work with the body and how it's causing this activation, this baseline dysregulation, then when we talk about things, it's bringing it up without a way to resolve it. And so it can make us even more just feel agitated in this inner tension. It's like, I don't even know what I'm feeling. I don't know what's going on. I just know that I am either pissed off or I'm super sad and I'm super emotional. My feelings feel out of control. And this is why I never want to do therapy.
That's 100% right. Is they say, this is how my body feels when I'm in therapy. Therapy is the source of this. It's not really the source of it. It's that your system isn't regulating enough to do the work. And please know, you need to do the work. You know, it's regulating the nervous system, new learning. When you try to separate those out, you can't get far, And then you're like, well, why did I just do that? Well, you just did that, but you need to do this too, and these things don't happen overnight and they don't unwind overnight, and you have to have patience. And I always say healing is like the stock market, right? That's exactly what it looks like. It's not like a skyrocket, Jeff Bezos, making it to outer space, but it really is, 3 step forwards, maybe a step back. And when you're doing the work and you just keep moving in the right trajectory and you release that trauma from your body, your brain can be freed.
Right. Right. And this is where I think that there is a lot of confusion still around trauma, is that people think that trauma is really just in their thoughts. It's just in their psychology, and they just need to change their thoughts, reframe their childhood. And that's not going to be enough. And that's why you even have somatic experiencing providers in your office. Along with all the other modalities that you do, because it's a great place to start when this activation is so high. It almost provides this stabilizing effect that's like, okay, and now we're ready. Now we can even do some of these other things. Now we can even talk about it, mention it, and not have this huge overreaction that lasts for days sometimes. So I know that there's been some question about, hey, I heard Dr. Rowe talk about somatic experiencing. What is somatic experiencing?
Yeah.
So maybe we'll end on that and encourage people to go listen to your full interview.
Yeah. And, somatic therapy has been around a very long time. And Peter Levine took it to the next level and really trademarked and made his process of somatic experiencing. And it's a type of therapy that lets you reconnect to your body so that you can ground. Yep. And that you learn, in the case of trauma, to create what we call a window of tolerance. You basically learn how to tolerate and work through this trauma that is stored in your body, this anxiety that's stored in your body, this depression that is stored in your body. And it really does a beautiful job of helping you to not be so darn heightened when your triggers happen. Right? And your triggers may be things and they may not. And in this process, you will learn what your triggers are. And again, at the tail end, you really want to do some of this other work to unwind the pieces that got you there. It's awesome therapy. I wish more people knew about it. And for me, it becomes really this base work that everything is built on.
Yep, exactly. And one of my goals since especially the pandemic hit has been to take these practices, these movements, these exercises that work directly with the nervous system and really give them to the people, right? Like, let me teach you some things that you can safely do at home on your own, because sometimes, who knows, like a pandemic may hit and you may not be able to go into a therapist's office. You may not be able to have that type of support. And these are things that Dr. Rowe, I think that everyone should have a basic understanding of their nervous system, of somatic work, because that's why we're getting off as a society, is that we don't even know how to process stress. We don't know how to process trauma. We just keep accumulating it. And the answer isn't to always just go see a therapist for the rest of our life. Like part of this is, hey, like these are skills, these are tools that somehow we've lost along the way. Let's get them back and let us help our bodies do what they naturally would do. And let's get out of the way of that, because we block that process.
And that's so critical, Dr. Aimie, because we need to empower people that there are tools, they are effective. And these are things that when you do them consistently, right? Not just once in a while, but you actually do them, are absolutely beautiful change makers and can be transformative in people's lives. So that's why I love this. And, I'm glad that you called your summit, The Biology of Trauma, because we have to understand and take away the shame. And when we teach people that it's about what's stored in the body and not what the thinking, right? The emotions, this is something we are completely in control of, but we can be control of in our body. And we start pulling it out there, we can quiet all of that inner chatter, that negative thought, those flashbacks, the whatever way it shows up for that person.
Exactly.
And they can feel so much better in their daily life.
Yes. And that's really the hope, right? These are solutions. These are tools that even starting today, starting tomorrow, you can have a better tomorrow by implementing this today. It's not something that that you have to wait a long time. These are simple, basic things that we can practice today. So I know that many of you still have questions. This is all maybe new information for you. I'm so excited you're here in the Biology of Trauma Summit. There will be more information on somatic experiencing later this week. Dr. Peter Levine, his interview is airing, and I will be even sharing more with you on some of the intro courses. I know that Health Means is selling my Intro to Somatic Experiencing course, so that is available for people. And then I've got a 21-day journey coming up after the summit. So there's lots of opportunity to explore this and to learn about this. For now, just enjoy the process and enjoy Dr. Rowe's full interview on activation, window of tolerance, and stress. Dr. Rowe, thank you, thank you, thank you.
Thank you for all your work.